Hey everybody, this week's patient that I decided to do my soap note on is an infant, initials Gigi, 4-month-old, 4-month-old female Hispanic who came to the clinic accompanied by her mother, and mother appears to be a reliable historian. So the chief complaint, they're here for the 4-month wellness checkup, but also some concerns about excessive reflux, and kind of jumping into the history of present illness with that. So the mother previously had breastfed her baby up to about 3 months. She would do it intermittently with formula as well. But with the breastfeeding, the reflux wasn't nearly as bad. But with the formula and everything since, she basically has spit up or reflux every feeding, and the mother states. Let's see. So the mother states that pretty much with every feeding with the formula, she spits up quite a bit. Like sometimes she feels like it's just as much as she gave her baby. And so let me just make sure I don't miss anything. So that's kind of a little bit of the history of present illness. Let's see. And yeah, so it's been around ever since she's been born, but it's basically the mom stopped breastfeeding, and so that's when it's really picked up, and she's obviously concerned about nutrition and dehydration and stuff like that. Anyways, kind of some other history. So the mother had a healthy pregnancy, denies drinking, smoking, any of that, during the pregnancy or since. Her daughter was born at 40 weeks, 7 pounds, 11 ounces, no complications with birth. Mother and baby were discharged 2 days after birth. So we kind of talked about the feeding. The baby eats about 4 ounces every 3 to 4 hours right now, but each time spits up, like quite a bit. Sometimes not as much, but just definitely a concern. Let's see. So kind of just going into more of the vomit, the spit up. So the mother denies the spit up being like projectile vomiting, but she does say that it seems to be quite a lot, but just not projectile. And then mother states the baby usually has a wet diaper every 2 to 3 hours, and she's having bowel movements 2 to 4 times a day. No like excessive diarrhea or days without bowel movements. And then so with vaccinations, so she's up to date currently, but at this visit, she is receiving the rotavirus, the DTaP, the Hib, the pneumococcal, and the polio vaccines. And then pertinent negatives, I guess, regarding the reflux specifically. So denies bilious vomit, dark, tarry, or blood-tinged stools, denies, the infant having a lack of appetite, forceful vomiting, constipation, diarrhea, abdominal tenderness, distension, prior illness, chronic infection, hypotonia, hypertonia, fever, lethargy, poor weight gain, or shortness of breath. And then just the positives, I guess, would be kind of what we've already talked about, just with her stating that she, spits up with every meal. So physical examination. So the examination was fairly normal. So the baby's length, 24 inches, which puts her at the 42nd percentile. Her weight was 14 pounds, 3 ounces, which actually puts her at the 65th percentile, which has been right around where she has been. So no, decrease in weight with like the added vomiting. She stayed kind of right on track. Head circumference of 16.7, which puts her in the 87th percentile, which she's always kind of had a larger head circumference. And then other physical examination. So she did have some slight hyperpigmentation in the bridge of the nose, and then kind of the the navis simplex on the back of her neck, which, aren't abnormal necessarily. And then she did have some slight atopic dermatitis kind of on the cheeks. But aside from that, bowel sounds were normal and active, abdomen non-distended, no apparent pain with palpation. Geez. And then the rest of the exam was normal. Blood flow good. All the vital signs were within normal limits. And no apparent, signs of dehydration. And obviously she hadn't been losing weight. So kind of with her milestones, the baby's milestones, they were all fairly normal. They were all normal, based off of kind of the history and then just kind of the observation with the mother and the baby. So differential diagnoses. So initially kind of hearing the history, thinking obviously kind of like the uncomplicated, gastric, the reflux, like I guess kind of GERD. And then I was also thinking possibly some bowel obstruction or hypertrophic pyloric stenosis. But with the physical examination and kind of the other history that was obtained, we can kind of rule those out. But the uncomplicated gastroesophageal reflux, that would be the main diagnosis that I would focus on. And then obviously there is some atopic dermatitis, and then we could use the Z code for vaccine administration as well, for this visit. So education. So continue to have, just kind of the basic education. I guess I won't go too much into that, but the basic education for the 4-month visit, safety with car seat, sleeping, not leaving the baby unaccompanied, like in a bath or in water, anything like that. Let's see what else, small objects, making sure they're all stowed away, so the baby can't have anything to choke on. In regards to the GERD, we educated the mother to avoid exposing the baby to any tobacco smoke, which she said she hadn't, but just throwing it out there. And then avoid overfeeding. So smaller meals, maybe give the baby a little bit less of a meal, and then positioning the baby in kind of more of an upright position for 30 minutes after feeds to see if we can kind of decrease the amount of reflux. And then so like try those. She said she hadn't necessarily been doing positioning the baby very much after feeding. So we told her to try those. And if not, she can also try getting a hydrolyzed formula, which I guess is supposed to help with reflux. It is a little bit more expensive. And then as well, another option is thickening the formula with a tablespoon of dry oat infant cereal. And they recommend oat versus rice, because I guess there could be some contamination with arsenic in rice. But anyways, and then we also talked about, so typically the symptoms of reflux should hopefully subside, as the baby ages to about 6 months, they should start to go away. And then in regards to the atopic dermatitis, we just educated the mother. She can apply lotion, or specifically, like in the more red areas, she can even put like a petroleum jelly to help that. And we educated her, she can do it, 2 times a day, if not more, but just to make sure she's getting some stuff on there to help protect the skin. And then we would just follow up with the patient in 2 weeks to see how the reflux is going. And, if she hadn't started either a different formula, if it hadn't improved, then we could educate her to do that. Or, educate her to kind of thicken the formula. All right. Thank you.